Hi, welcome back to Your Checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited that you were able to join us again today. You made a meal that was like God's food. It was beautifully plated. It looked delicious and tasted even better.
I know. I should have taken a picture.
It would have been great if you did. Tell us.
I'll have to make it again.
Tell us what this was. When you walked over this plate to me, you described it in a beautiful way.
So it was a brown butter. What did I use? Sage and rosemary. Not sage and rosemary. Sage and thyme. It was a brown butter, sage and thyme pumpkin gnocchi on a bed of whipped hot honey ricotta.
Wow.
Oh, and like crumpled. I made a couple pieces of bacon, crumpled it up, and like put that on top. So it's like, because like the pumpkin and the ricotta are kind of sweet, and then the bacon is like a little salty, savory. You know, it was good.
Out of this world. It was so delicious. I mean, I didn't even know you kept this secret. You were accumulating ingredients when we went to the store. Like, what is she up to? What is she thinking about? And like, there's no secrets with me. Like, if I'm doing something that you know about it, but you, secret mission.
Yeah, it was so good. Except I think it would be better. It looked really pretty on the plate, but we need those dishes that are like plates but bowls. We don't have it. Like, we have plates and we have bowls, but we don't have a plate bowl. You know,
A blate.
Yeah.
Or a plole.
We need them. Because I think everything actually looks better on those plates.
A plole. Mm-hmm. Is it more plate or bowl?
I think more bowl because like the edges are up.
Oh, I think, okay. For the first like 20 seconds of that interaction, I didn't know what we were talking about, but now I think I have it down about what we were looking at there. That meal was incredibly delicious. The honey whipped ricotta at the end, I just intermixed with everything. It was so, it was just beautiful. I'm so lucky. That was great. Wow. What else is there to say about it? Wow. That was just amazing. That was so good. You're awesome.
And then you went back for more, per usual.
Well, yeah. Oh, man. Okay.
So what are we talking about today, Eddie?
Well, it's a really important topic. And as we come to the close of October, we also come to the close of Breast Cancer Awareness Month. And so we are going to spend some time talking about breast cancer screening and the mammogram today. So let's start with the basics. What exactly is breast cancer screening and why is it so crucial?
Breast cancer screening is when we check for breast cancer even when a woman does not have any symptoms. And this allows us to catch the disease in its earliest stages, potentially even years before she can feel a lump. And early detection dramatically increases the chances of successful treatment and survival.
Yeah, super important, super common. Who should get screened for breast cancer, though?
The general guideline is that women between the ages of 40 and 74 who are at an average risk for breast cancer get a mammogram every 2 years. But then again, this is just a general guideline, and women who are at higher risk or have like a strong family history or other factors their doctor may tell them to get screened more frequently.
Yeah, so you should definitely talk to your own doctor for your own individual risk factors because, I mean, we were having conversations today where people are getting them yearly. So that's not uncommon, but the general guidelines, especially from primary care standpoint, do every other year. So if you're 40 years old, you get one then, and then you'll get another one when you're 42, according to this guideline. But really, you should be checking with your own doctor. So let's talk about the mammogram itself. I feel like a lot of women are apprehensive about the procedure. Can you take some time and walk us through what happens during the mammogram?
So you'll stand in front of a special x-ray machine, and then the x-ray tech will place your breast up on a little platform, and then another one comes down and squeezes it. And I'm sure that they tell you that it's gentle and it's just a little bit of pressure Like when you get a pap smear or get an IUD in and they say it's just going to be a little pinch and it's like
just a little
pain
pressure
of your entire life because they're dilating your cervix. But I digress.
Just a little
So
pressure.
your one breast gets smushed. They take some pictures. I hear it's pretty quick. It's about like a pretty uncomfortable, like 30-ish seconds. Then you turn around, you squish the
Bang,
next
do
one,
the next one.
and then you're done. And, you know, most people only have 2 breasts, so it's something that only has to be done twice. You know,
Nice. Yeah.
sometimes, you know, a third nipple.
Right. Yeah. So
Never know.
you never know. And those are basically the ins and outs, as I understand it, of the mammogram. There are other screening techniques, like for women who have dense breasts, sometimes need to go get ultrasounds as well. And then further down the line, there are MRIs, but I feel like those are much less commonly used. And so those are the 3 main modalities for breast cancer screening, with the mammogram being obviously the most convenient and most commonplace one. So I feel like you talked about some discomfort there, and that this experience isn't all sunshine and roses, which can cause that apprehension we were talking about. Are there some things women can do to maybe make the experience more comfortable?
Yeah, I mean, it's not going to be comfortable.
Yeah.
But ideally, like if your scheduling allows, you can schedule it kind of like around your period. If you're someone who's your boobs hurt when you have your period or like the week leading up,
Sure.
just don't schedule it during that time because then it will probably just be like straight up painful.
Right. Like it doesn't seem like that's going to make it any better
Yeah.
for an already uncomfortable situation to add more discomfort. Okay.
Yeah. And also not for like comfort reasons, and they'll probably tell you before your appointment, but don't wear any like deodorant powders or lotions the day of your appointment because they can interfere with the images and you want them to be
Pristine.
crystal clear.
Yeah. So speaking of those images, how long does it take to get them? And I guess if there's anything else, like if it's something's abnormal is found, what are we doing about that?
Getting the results back and how quickly usually depends on the office. Usually it's about a couple weeks, and then how you get those results will differ. Like I know people will get a letter in the mail if everything's fine. Some people get a phone call, or if you have like a patient portal situation, your result might pop up once your doctor views it. And then if you're normal, you'll be good, and then you'll just keep getting it on whatever your routine schedule is that your doctor tells you to do. But then if there is an abnormality, there will just be additional imaging and test, and then you'll kind of take it from there.
Yeah. All of that can be really anxiety provoking, I imagine. Usually the next step is either an ultrasound or a biopsy. And so that's like the tricky part with this, is that there are risks and benefits to doing the mammogram itself.
I heard of so many people who like find out they have breast cancer, which you can cut this on like their patient portal. And, like,
yeah,
the results
that's,
pop up, and
that's
then
like
they're
that's poor taste. No, I might not cut this. That's poor taste. Like
Yeah.
you pick up the phone. I mean, this happens. There's a lot, and like the breast center that I'm familiar with, like really sends detailed letters to the patients. Some things deserve a phone call.
Okay, Eddie, tell us about the risks and benefits associated with the mammogram.
Well, the most significant benefit is the potential to detect breast cancer early, and especially when it's smaller and easier to treat. This can significantly increase the chances of survival and a better outcome overall. But I do have to say that there are some risks to be aware of, including, for example, that there are risks of false positives. And that means that the mammogram might show something suspicious that actually turns out to not be cancer. And so the consequences of this are anxiety or increased testing and additional procedure. And another risk is overdiagnosis, where a slow-growing cancer is detected that may never cause problems in general. And this usually plays in while you'll notice there's an upper age limit to the mammogram, because sometimes, not to be morbid here, but like sometimes they may find something that doesn't matter because it was in a 120-year-old person, and one might expect that that person might not be around too much longer. So why go digging around for a mammogram in that person is why there's an upper age limit. Usually that's a conversation between the patient and their doctor. So the bottom line of this episode as we kind of wrap up here is that the most important thing is to go get screened. I mean, this is affecting half or over half of the population, especially in that age range. And it's simple. It's easy. I know a lot of systems have this all set up already where, I mean, we've heard an example today where you send a phone call in to schedule and they have you in 4 days. There are whole centers dedicated to breast cancer screening. It's extremely important, and you just get out there and do it and give some peace of mind, or find something early and get it taken care of while you still can. So now that we've given all that information, go back and forth here. Any thoughts about breast cancer screening, mammograms, anything like that?
I don't think so.
I feel like a lot of people don't get them.
Do you?
Kind of. Yeah. I feel like sometimes it's like you have to go do this, but they like out of sight, out of mind. There's a lot of cancer screenings, I feel like.
Like what else?
I mean, people avoid colon cancer screening altogether all the time. But that one's like, I feel like it's more your traditional colonoscopy sounds.
I feel so skinny after that, though.
At least more invasive. I feel like most people avoid the prep, and then you have the stool samples, so there's an alternative. But for this, like those 30 seconds to a minute of discomfort between the plates, like it doesn't sound like there's too much avoiding that, save going for an ultrasound, but I'm not even sure if that's like a reasonable thing to do. So there's a lot of apprehension, out of sight, out of mind with just cancer screenings in general. That's one thought I have.
Just go do it. You've probably done worse things. Get yourself a little sweet treat after. It'll be okay.
Yeah, take care of yourself. Do something nice. Go to one of these places. Go get a pastrami sandwich.
Oh my God.
I am obsessed with this sandwich now. Every time I eat it, I see God. And it's just, I mean, a lot of people go to church,
and he goes to the Jewish deli.
Liam. So, thanks for coming back for another episode of Your Checkup as we kind of wrap up Breast Cancer Awareness Month here. But we're always going to be breast cancer aware here on this podcast. Please check out our website. The Buzzsprout people revamped the websites, so it's much easier to find all the different things, all the different places that you can listen to our podcast. Please rate and review our podcast. It doesn't have to be like a novel written by Henry David Thoreau, but it'd be nice if you wrote something nice or constructive about what we're doing here. Share this with a friend, a loved one, or
a neighbor with breasts.
And let them know what we're talking about, because maybe they'll find something else in one of our other episodes as we're building our more comprehensive library on health topics that you can be educated on.
You know who Henry David Thoreau is?
I have layers. I'm a dynamic man. So I already know we did this bit already, but humor me here and say thank you for coming back to another episode, and hopefully you were able to learn something for yourself, a loved one, or
a neighbor with breasts.
And we hope you come back next time. Please leave us some fan mail. And most importantly, stay healthy, my friends. I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.